Welcome to our presentation on cough, cold, flu by Sai, Heba, Olivia, Patricia, and Jules. So to begin, the clinical presentations of cold or flu can include congestion, rhinorrhea, fever, cough, sore throat, body aches, and fatigue.
So to help prevent illness, we can wear a mask around people who are showing symptoms or in public spaces where we might be exposed to germs. It's also important to wash our hands regularly with soap and water or use hand sanitizer, especially after touching surfaces in public areas. And of course, maintaining healthy habits like eating a balanced diet, staying active, and getting enough sleep can really help to strengthen our immune system.
So our first drug class is antitussives, which include benzonatate, codeine, dextromethorphan or DXM, and DXM hydrobromide and Polistrix. For the mechanism of action for codeine and DXM, they're both direct inhibitors of the medullary cough center, and benzonatate suppresses coughs by desensitizing the lungs and the respiratory passages to outside stimulus. Some adverse effects of the drug class include dizziness, drowsiness, serotonin syndrome, constipation, dysphoria, and numbness in the tongue, mouth, and throat. Codeine and benzonatate are not available over the counter. However, both forms of dextromethorphan are available as an over-the-counter medication. So dextromethorphan hydrobromide is available as a lozenge, capsule, sublingual strip, or syrup, and dextromethorphan Polistrix are available as an oral suspension, and their prescription options and cost are listed. And for some safety considerations, taking dextromethorphans and MAO inhibitors together or within 14 days of each other can cause serotonin syndrome. That is very dangerous and can cause seizure and cardiac arrest, as well as other symptoms. People with chronic respiratory illnesses, such as COPD and asthma, should not take antitussives for cough related to their disease process, as this can be dangerous to suppress the cough. And DXM should not be used in children less than 2 years old because infant deaths have been reported. The next drug class are antipyretics. These include NSAIDs, however, those will be gone over later in the presentation, and acetaminophen. The mechanism of action for acetaminophen is that it inhibits prostaglandin synthesis and availability in the CNS. Some adverse effects are itching or hypersensitivity, constipation, nausea, vomiting, and liver failure, and it's available over the counter as well as via prescription. Acetaminophen is available as a capsule, a suspension, tablet, or a rectal suppository, and the prescription options and cost are listed. Some safety considerations: acetaminophen should not be taken with isoniazid due to a high risk of hepatotoxicity. Since it can't be taken with that medication, patients with TB who are being treated with it should not take acetaminophen, and if they're experiencing a fever, they should contact their doctor or their provider who might prescribe an NSAID, which would be a safer alternative. Imatinib, which is a cancer medication, is an inhibitor of acetaminophen, and when it's taken, the serum drug concentrations of acetaminophen can increase, which could cause toxic levels, and hepatotoxicity could occur.
The next drug class we're going to discuss is decongestants, and these drugs are pseudoephedrine, phenylephrine, and oxymetazoline. These are sympathomimetics that activate receptors to cause vasoconstriction, reducing edema, and allowing mucus to be drained from the nasal passages. Pseudoephedrine is unique in that it is an indirect agonist, so it causes more systemic effects than other drugs in this class. Adverse effects are seen from SNS activation, with hypertension being one of the most common. Also causes hypersensitivity, rebound bradycardia, psychosis, conjunctivitis, and irritation of the nasal mucosa. All of these medications are available over the counter, and stronger formulations are available by prescription. For the sake of time, cost breakdown is located in the table, but I won't be discussing them. But phenylephrine is available in nasal spray and tablets. Pseudoephedrine is available in tablets and capsules, including extended release, and an oral solution suitable for children aged 4 and older. Oxymetazoline is available only as a nasal spray, but in a variety of concentrations. It's important to note that we want to recommend only a nasal spray or an oral form of the medication to avoid possible toxicity. There are multiple drug and food interactions, including a number of interactions that can cause an increase in blood pressure. This includes concurrent use with MAOIs, adrenergic agonists, and bitter orange. Use with other intranasal medications can decrease their efficacy, and decongestants can also decrease efficacy of insulin and cause hyperglycemia. Therefore, we want to be careful with use in patients with diabetes, and we definitely want to avoid use in patients with hypertension, coronary artery disease, because of the risk of a hypertensive crisis. There are cold and flu medications formulated specifically for people with hypertension without decongestants to avoid this issue. We also want to avoid use in children under the age of 4 and patients who are pregnant, breastfeeding, or have diabetes. The next drug class is local anesthetics, and this is benzocaine in lozenges or phenol in chlorocept throat spray. They block nerve conduction by decreasing cell permeability. Adverse effects include hypersensitivity and altered taste. Phenol is available as a throat spray, and benzocaine is available in a lozenge form. Both of these drugs are available over the counter and don't require prescription. Some safety considerations include benzocaine may reduce the efficacy of sulfonamide antibiotics, so they should not be used together. Benzocaine can also cause methemoglobinemia. There's a higher risk of this in patients who are elderly, have heart or metabolic disorders, asthma, and history of smoking, so we want to avoid use in these patients. Local anesthetics also are not appropriate for children under the age of 2 and those who are pregnant or breastfeeding. We also want to advise patients to stop use for severe or persistent sore throat, especially if they also have high fever, headache, nausea, and vomiting, so we don't cover up a severe infection.
The next medication class that we'll be looking at would be the expectorants. Mainly, the main expectorant that's on the market right now is guaifenesin. And guaifenesin works by irritating the bronchial mucosa, and so it increases the volume of fluid, but it decreases in order to kind of decrease the viscosity of the mucus in the airway. And so by increasing volume, decreasing viscosity, it allows the user to be able to expel the mucus more easily so that whatever pathogens are trapped, they're able to kind of get rid of more quickly. Some adverse effects of guaifenesin would be mostly in the GI tract, such as discomfort, sometimes nausea and vomiting. And guaifenesin is sold in immediate and extended release dosages to work in different ways. It is available over the counter in the form of an oral tablet or an oral solution. And as you can see here, we have the 2 different forms. There is, like I said, there's the immediate release and the extended release tablet. Both dosages and medication costs are listed, as well as the generic and the brand, which is Mucinex. And finally, some safety considerations for guaifenesin. When it comes to the research and the literature, there's not a lot of major drug-food or drug-drug interactions that have been listed. However, guaifenesin is usually sold in combination with other cold medications, such as dextromethorphan. It's considered to be slightly unsafe in the younger than 2-year-old population, so it's recommended to avoid in under 2. It's also recommended to avoid in pregnant and breastfeeding mothers, since there's not a lot of evidence of safety. And finally, when it comes to toxicity or overdose, there's not a lot that has been reported when it comes to expectorants such as guaifenesin. However, it has been shown that there's slight CNS depression, so it's important to be mindful of that as a provider.
So our next class is non-steroidal anti-inflammatory drugs, which are widely used class of medication known for their analgesic, antipyretic, and anti-inflammatory effects. Their primary mechanism of action involves the inhibition of cyclooxygenase enzymes, which is responsible for the synthesis of prostaglandins. Examples of commonly used NSAIDs include ibuprofen, aspirin, naproxen, and magnesium salicylate. These medications are available in both over-the-counter and prescription forms. Some common adverse effect includes tinnitus, nausea, indigestion, GI ulcers, GI bleeding, and they may increase the risk of issues such as stroke and heart attack. So NSAIDs are available in various dosage strengths and price points, offering flexibility depending on patient needs. For aspirin, commonly used options include Bayer, Bufferin, and CVS low doses. For ibuprofen, it is available as Motrin, Advil, liquid gel minis, and for children, there is Motrin chewable tablets and Pediacare oral solutions. So depending on the age, there are quite a few options to choose from. And for naproxen, it is often sold over the counter as a leaf 220 milligram sodium tablets with higher doses requiring a prescription. For these medication, the prices range from $8.99 to $30 as shown in the slides. NSAIDs require caution in special population. They may cause fetal kidney issues after 20 weeks of pregnancy and are not recommended for children with viral infections due to Reye's syndrome risk, and older adults use it with extra caution due to a higher risk of serious side effects and drug interactions. For drug-to-drug interactions, NSAIDs may prolong bleeding and enhance the effects of antiplatelets and warfarin. Also, concurrent use with SSRIs increases bleeding risk, and with lithium, it may increase lithium levels and risk toxicity. And there are several potential medication safety issues to be aware of when using NSAIDs. It should be avoided in individuals with aspirin allergy due to cross-sensitivity, and also should be avoided for individuals with a history of GI ulcers, liver disease, or bleeding disorders. And lastly, alcohol use increases the risk of GI bleeding and should be avoided.
Our next class includes the antihistamines. The examples include diphenhydramine, chlorpheniramine, cetirizine, and loratadine. They can be classified into two groups, first generation and second generation. The mechanism of action for first generation is that they're non-selective and they inhibit the H1 histamine receptors both centrally and peripherally, versus the second generation selectively inhibit the peripheral histamine H1 receptors activity only. The adverse effects of first generation include dry mouth, blurred vision, urinary retention, drowsiness, dizziness, GI discomfort, including nausea, vomiting, constipation. And second generations have less side effects compared to first generation. However, they can include GI discomfort, headache, fatigue, malsedation / drowsiness. And all these medications are available over the counter. So all these medications also come in oral tablets form, and this table includes the dosage information and the cost breakdown of each medication. For the drug-to-drug interactions, first-gen antihistamines should be avoided, taken with CNS depressants such as alcohol, benzos, opioids, sleeping aids, and anticholinergic drugs, MAO inhibitors, and beta blockers. Second generation histamine, cetirizine, should be avoided, taken with other CNS depressants, and loratadine should be avoided, taken with grape juice. Considerations for special populations include children. So first generation antihistamine should not be recommended for young children and can lead to sedation and respiratory depressions. For geriatrics, first generations are also not recommended due to the CNS and anticholinergic risks. For pregnancy and lactation women, diphenhydramine can cross the placenta and may cause fetal sedation and is not recommended as a first-line treatment. And then patients with comorbidities, first-gen agents are also avoided, and second generations are usually safer for them to use. For potential medication safety issues, there's three: sedation, so one including sedation and CNS depression. So first gen can impair the coordination, cause confusion, increase fall risk, especially in elderly, and therefore can lead to falls, accidents, and cognitive decline, as well as impaired driving. Anticholinergic burden would be the second, and first generations have anticholinergic side effects that can often lead to delirium as well. And then lastly, third would be the overuse or the accidental overuse for first generation medications, which can lead to toxicity, excessive sedation, and arrhythmias and seizures.
So as you've been able to see, there are plenty of pharmacological options that can help with cold and flu. There are also many alternative and complementary interventions, such as sinus rinses, which can kind of help clear mucus, steam inhalation, which can loosen and help with the viral action, gargling salt water, which can help to detach pathogens and also have some antimicrobial effects, and honey and ginger tea, which we know can soothe a sore throat and also have slight anti-inflammatory and antiviral effects as well.
Overall, there's many drug classes, as you can see, that are available to patients. There's 7 drug classes, 18 drugs, and 65 available products. They are, however, relatively affordable and available, and sometimes available with multiple active ingredients in one medication. Here are our references. Thank you so much for listening.